Hi, everybody. A very warm welcome to the Sunday webinars by FitNCalm. Can we all turn our videos on so I can see you? Welcome, Deepa, Kshitija, Lakshmi, Nidhi, Richa, Seema, Sonali. You guys can let us know in the chat how you are doing. So today's session is going to be a very special one. This is specially organized for all our women community, considering that a lot of people have issues because of period pain. So we have Dr. Urvija today with us, and Dr. Urvija will be taking us through what are the things that we need to do when it comes to periods, especially when it comes to our dietary habits, when it comes to our lifestyle, when it comes to the activity. So there are few things which will increase the pain. There are few things which will decrease it. So we will know what to do and what not to do. Dr. Urvija has also taken a lot of sessions earlier for us. She had taken once on do's and don'ts of yoga and periods. And she is not yoga, I'm sorry, do's and don'ts generally of like menstruation. Yoga we had done specifically. So if you want to know that, do's and don'ts of yoga, so you can check out our YouTube channel, FitNCalm's YouTube channel. And Dr. Urvija is a practicing Ayurveda doctor. She's done her BAMS and currently she's also specializing in Prasuti Tantra and I don't know the rest of the words, but she can say it's OB-GYN in Ayurveda basically, that much I know. And she's really knowledgeable and she's here to give us, her time and to just make us aware of what to do, what not to do. So, Dr. Urvija, very warm welcome. And I would encourage each one of you to turn your videos on. It's especially nice when someone is taking out time from their schedule to give us some knowledge, if we can just give them that encouragement by showing us our faces. So, Dr. Urvija, welcome.
Hi, thank you. Thank you for the introduction. And let me first just check out everyone. Yeah. Hi, I am Dr. Urvija, actually, as introduced, and it was very encouraging words. And yeah, so the first thing I want to tell you, I mean, the starting that I want to tell you is that congratulations that you have come here, because this is something that we are facing it on daily basis. You or your near and dear women are facing it on daily basis, but we really don't know what is happening. We really don't know, is it actually a disease that is happening, or is it something wrong that we are doing? So from this webinar you will understand this minute thing, but very necessary, which is very necessary for you to understand what is wrong in your body. So I'm an Ayurvedic doctor, so Indian syllabus counts Ayurveda, and when we are learning Ayurveda, we are even taught modern, because nowadays the people understand only the modern terms, right? So we are trying to get into Ayurveda, but we are trying to correlate it with the modern terms as well, so, just so that you understand it better. So this painful menstruation is given the terminology which is called dysmenorrhea, whereas this means which is painful, and menorrhea is the menstruation. So the painful menstruation that is causing all of these abnormalities in your body is this terminology. So this can happen because of two main things. It can either be your mental faculty that is affecting, or your anatomy and physiology, that is the actual disease. It can be either psychosomatic, is what I mean by mental faculty being involved. That is, you can be either mentally little depressed or a little low, not exactly depressed but a little low also, will affect your periods. Now I tell you why is this happening. This is because a woman's body, it changes every month. It's not the same with the men, right? Men do not have menstrual cycles, or they do not have a change in their entire body system every month. They just have once, that is puberty. That's it. After that, they just keep going, they just step forward, that's it. But in women, we have different stages, like we hit the puberty, then we go for pregnancy, then there is delivery, then there is before menopause, we call it a climatic change, that the change is to reach menopause. Then finally, we reach menopause. So these are the 5 changes that a woman undergoes. So for these changes to happen, there are a lot of hormonal changes that are happening in your body. So you're not stable all the time. And also, this is not just these 5 changes, but even in the monthly cycle that is happening, there are a lot of hormones that are playing role there, and that is why your menstrual cycle takes place. The bleeding that you see, that takes place. And the bleed, when I say menstrual cycle, it is not just the 5 to 7 days that we talk about. It is the entire month, because your body is being prepared. The uterus is being prepared for your cycle to be seen. The 5 days is just what you see, but rest of the things are also happening in your body. So how is this taking place? This is all because of something that is present in your head, that is the hypothalamus, is what we say. And this hypothalamus is so sensitive that even if you take bath, or there is change in the temperature or change in the climate that we see, there's going to be a change in your body system as well. And for us women, this is shown through the menstrual cycle. So even if you have body pain, I tell you, I can connect it to your menstrual cycle. So there are everything that is happening in your body is shown through your uterus, because that is very sensitive, is what is the baseline here. So to understand all of these things, we'll also know about how Ayurveda understands diseases. So Ayurveda understands diseases as 3 different things. That is, we call it them doshas. That is Vata, Pitta, and Kapha. So your body system is made up of Vata, Pitta, and Kapha. When these 3 are in a balanced state, we say that you're disease free, or you do not have any problem, or you do not tend to have any problem. But that is a very rare thing. But your prakriti, that is the thing that you are made of, it can be either a little more of vata, a little less of pitta, or a little balanced of kapha. So it is very unique to each person. That is why we say that we do not have a protocol to follow. Each person is different for us. So that is why when this particular prakriti, when you understand your own prakriti, then you know how to manage your day-to-day regime, right? What is good for you to eat, or what is good for you as an activity to be done. So I've told you that everything in your body, when it is good or bad, it is shown through your menstrual cycle. So when you understand what you are made up of, when you start becoming sensitive to what is good for you and what is bad for you, your menstrual cycle automatically becomes normal, right? And once your body makeup, if you like I said, I cannot really explain what vata pitta kapha is in this short period of time, but I really want you to know, take interest in this and know about what is this, and then you can assess yourself about what prakriti you belong to. All right, now amongst these things, the female has more changes in the vata cycle, because every movement is taking place with this vata. If there is no vata in your body, there is no movement in your body. So when vata is either vitiated, or that means either high or low than it is supposed to be, then there is a problem, or the body pains or any kind of pain in your body that you see is because of this vitiation of the vata, is what we say. So, and also we understand that the movement is because of vata, right? So when there is bleeding, the blood that is coming out is because of the movement of the vata that has to go towards the gravity. It has to go downwards. So that is why you can understand things here, right? The food that is causing you bloating, anything that is vata, is air element in your body. When the air element in your body is increasing, that is when any food that, like potatoes or chana dal or legumes that you eat, any kind of dal, in fact, when you consume this, there is bloating that we notice. And some people are more prone to this because they already have this kind of a problem, and plus they start taking these kind of food. So once you start understanding what your body is telling you, you can stop avoiding these things. Like I said, that we understand each person differently, but you can understand yourself by giving yourself a little bit of attention. right? You understand that this food does not suit me, this food is causing bloating in me, so this food is causing constipation and not good for my digestion. So when you start understanding this, then you can avoid all of these issues as well, right? But we have few general things also that we can say that, yeah, you can avoid things like I said, potatoes, brinjals, you can avoid cauliflower, cabbage, and the legumes, any kind of chana dal, black chana, or chickpeas, anything, you will have to avoid all of these things to avoid any kind of pain during menstruation. Not only menstruation, but any kind of pain in your body. Now, why is this pain happening? First thing I said, it is called primary dysmenorrhea, where we do not exactly know what is the reason. It is primary only to your period. When you have your period, you have pain. But there is also something called secondary dysmenorrhea, when you have an underlying pathology to it, when there is a disease associated with your pain. This can be, we can just check a few things, like we can investigate your body and then get to know about what is happening, and then that can be treated. But what is the main concern here is the primary dysmenorrhea, where we do not know why is this taking place, why is the pain taking place. But in Ayurveda, like I said, we say that the vata is increased during this time, and also the natural vata is dominant during this time. But then, instead of the natural vata that has to come down, when it increases or gets vitiated in its nature, it starts moving upward. Once it starts moving upward, the normal menstruation, you can notice there is a little less amount of flow, or there can be increased amount of flow as well. But the normal amount of flow is hampered there. So that is why these are the small things that you have to notice and let the doctor know. So when this is happening, you can just take care of the food that you eat, like I said, all of these things. But other than these things, activities, next comes to activities. What are the things that you should not be doing? Nowadays I've noticed that people enjoy gymming, right? They enjoy gymming, they are just so considerate about losing weight, or so considerate about that has become the primary thing about losing weight. But you should also understand that the weight is a secondary factor of a lot of things that are happening, right? So instead of just trying to lose weight, you just have to balance your body first. That can happen when you do yoga. But when you're gymming, I've noticed that a lot of people even gym during their period time, which is not encouraged. Period time gymming increases the activity in your body in by 2 times. The activity starts flowing in, and the blood supply starts flowing in way too much, which is not very good. And also in Ayurvedic terms, the vata gets vitiated, and we call it the vriddhi of vata, that is the increased vata, which is not which is again causing a lot of pain in the body. And when we say lower back pain especially, and then these cramp pain, that is because you can even notice that once the menstrual blood that has come out, a few people notice that the pain has come down, right? I don't know how many of you feel this way. You can just say yes or no if that is happening with you. Once the menstrual blood is out, you might see the clots, and then your pain is reduced. Is it something like that happening with you? Okay, so I see a lot of patients that notice this, that once the clots come out, then you feel a little relieved. This is a sign that your vata is not moving in the right direction. Your vata is struggling to come out, but then there is so much vitiation in it that it is being stagnated there. Something like bloating in your uterus is happening, right? So that is not correct. So once this blood is coming out, this stagnated blood is not is causing this pain. Then once the stagnated blood is out, then at that moment you can release this pain. As this is a simple explanation about how vata works. This is a simple explanation about how actually vata is playing a role there. So something like air, and you understand how filter coffee works. How do they make filter coffee, right? They create a vacuum inside, and then a little a very little droplets start dropping, right? So this vacuum in your uterus, when it is formed, it is causing pain. This is not supposed to happen. So your flow should be normal, and for either 3 days to 7 days is normal. So, understand your body is what I want to tell you. Understand your body, the normal functioning of your body. Understand what is good for you to eat, what is bad for you to eat. Like, we enjoy a lot of things. The tongue says, yes, I want to eat all of these junks, I want to eat all of these bakery items and all. But is it good for you? Sometimes, yes, we do not say exactly no to it, but then sometimes okay, yes, but then on a daily basis, if it is hampering your body, do not take it. And also, like I've been specifying about vata dosha here, the digestive system of the vata is very hampered naturally. Like sometimes they feel there is a lot of hunger, and sometimes they feel that there is no hunger at all. So how do you balance this? This is, you should agree, you should just understand, if you are a vata prakriti person, then eat according to your digestive system. If you're feeling a lot hungry, eat proper food, eat heavy food at that time, no problem. But when you're feeling that your digestive system is low for this time, then do not eat a lot of food. Try consuming something that is easy for your digestion, something like khichdi, something like soft cooked rice. Put a lot of water in the rice and then cook it. Avoid vegetables like potatoes and all that I've mentioned before. And make yourself a very what do you say, you should make yourself what just notice yourself first. Start noticing what is happening. Okay. So once you start doing this, I tell you, automatically all of these complaints will come down. Because amongst, if it is an anatomical defect or a physiological defect, that is either your uterus is anatomically not proper, or your hormones are not playing their role properly. Unless these two are happening, the doctors cannot help you. If these two are problematic, then yes, we'll just check you out, we'll give you the medicines for it. But if it is psychosomatic, if it is in your head, then only you can help yourself. And also a lot of these daily regime is going to help you. The FitNCalm people have already, we have just done a video on what you're supposed to do during your periods and what you're supposed to not during your period, right? So once you start following these things in your daily routine, this is going to help you tremendously, I tell you. And these are very small tips that will help you. And if you want medicine, yes, I'll give you, but why do you need it is what I ask. If you can just take care by food, and if you can just take care by giving a little mental support to your body. And we've got a lot of patients whom we help only with yoga and with meditation. Because like I told you, the hypothalamus is like the crown in your body, right? So if that crown is stable on your head, then your body works properly. If not, then you see all of these complaints. In women, you see it through your period. And that is why, take care of your health, take care of your mental health especially. And yeah, and coming on to yogasanas, yes, we can do, we have Kushpinder ji, who is an expert on yoga. But I can just tell you simple things, that don't do any kind of inversion yogas during your periods. And we do not encourage a lot of movement during your period. But then if you have pain, there are certain asanas that you can check their YouTube, where it will help you relieve those symptoms. So for symptomatic relief, yes, you can do that yoga. Do it as much as you can only. And then do not exert yourself during your period. And do not work a lot. Do not sit in a place where you're working a lot, either mentally or physically. So take care of these minute things and you'll be good to go. It might take around 3 months time for your new lifestyle to set in. for yourself to just start understanding yourself and taking care of what you should do and what you should not do. I've told you very scientific things here, that is what we notice in a patient. But yes, once you start noticing yourself with these minute symptoms, that what you're eating, what you're doing, if this is corrected, you'll be fine. But if not, then we'll just help you with the medication. And also, to help yourself, try doing these basic yogasanas when you're not menstruating. And during your menstruation, whatever your symptoms are, accordingly you can do the yoga. And then try meditating daily, because your hypothalamus is balanced at a different level when you meditate regularly. So start doing these things. And you've taken your time out to understand what is happening with your body here. So I've given you this basic thing. Why don't you just follow, do something that is coming home to you, right? Okay. So if you have any, do we take questions now?
We'll take the questions after the meditation. But can you tell
Okay.
us, like you mentioned vata increasing foods. So you mentioned potatoes, brinjals, the dals and lentils. So these are the things we should avoid. Is it only during the periods, or because otherwise, these are for a vegetarian, these are the only sources of, protein as well. So, or is it, a specific time when you should avoid it in the day?
Yeah, like I've mentioned about bloating, right? So when people prone to bloating, they understand their body, right? If I eat something, if I eat chana dal, I feel bloated. If I eat rajma, I feel bloated. That is how it is to me. But it might not be the same to you. If you are okay with it, yes, you can have it. If but I am not okay with it, so I wouldn't have it on a regular basis, right? But during your period, strictly avoid this. Try taking something that is nourishing and easy for your digestion. Something that acharyas have mentioned is good, that is the jaggery, milk, and very soft rice. You can take this, it tastes like kheer only. You can take this during your period time. Other than this, yes, you can have normal dal. You can obviously, I'm not restricting you at all, but then I'm just telling you, throughout your month, just understand how your body is working. If you're feeling bloated, do not take it. If not, vegetarians also have a lot of choices, right? So we can eat, for that day you can eat a better kind of food. Instead of eat ghee, take ghee. And if you're feeling bloated, take hing in your food.
Okay. I just wanted to ask, how many of you face like a lot of period pain? Like you have a lot of pain during your periods. You can raise your hands or you can type in the chat as well. Yeah, I can see some hands raised. Okay. So what are the issues that you guys face? You can just, yeah, first day, Kajal is saying first day basically. Some of you had also asked what are the do's and don'ts that you had covered, if we can go through them briefly as well over here. Yes, we'll do that, Ankita. We'll go through that at the end, very end. Yes, she's saying, can we be unmuted? Yes, give me a second. I'm going to unmute you.
Yeah, hi.
Hi.
I can't see the doctor now, actually. Can you please spotlight her?
Yeah, she'll be spotlighted once she starts speaking.
Okay, great. So I have a question. I'm 44 and it's not related to pain. So can I ask the question now or do you want me to wait?
Yeah, we'll take the questions at the end. I just wanted to ask, like, if it's specifically with period pain, so that we know what all everyone is going through, so we can
Okay.
pick up everything at the.
Great.
Okay, okay, no problem. Yeah, so we are getting some messages in the chat box, especially on the second day. There is pain, there's lower back pain, body pain as well. Okay. All right, lower back pain, severe headache. So these are the problems that you are facing. So I think, Urvija, we can tell them the solutions to these after we meditate. So one of the things that we should surely have in our everyday practice is meditation. Some breathing exercises, some meditation, because like she mentioned, the hypothalamus is very, very sensitive. So even little changes can cause a lot of problems in the body. For example, just taking head bath during the period. So this is one thing which not a lot of women take care of. So head bath during the first few days of the period should be like a strict no. And everyday meditation also should be a part of our routine every single day, not just during our periods, but even for the rest of the time as well. So every week we do these webinars and we have a speaker here, and we also have a few minutes of meditation, because that's also something which is very, very important. So let's meditate a little bit. So we'll meditate, and after that, we'll take up the questions and all the problems that all of you have mentioned. We'll also look at what are the things we can do to take care of these as well. So for meditation, all you need is just sit straight, make sure your spine is straight. That's the only thing we need to take care of. And apart from that, just follow the instructions like a child would, with that innocence. Okay. Before we start, we'll just shake off our hands. If there's any laziness, anything, just let it go. Take the hands up and shake it with a smile on the face. The smile should not go. Back to the center. Take the hands to the right and move the body a little bit to the left as if you're dancing. Take the hands to the left, the body a little bit to the right. Once again, come back to the center. Now let's move our hands in circles. Keep shaking them. Now the opposite direction, let's shake them. Now bring them back to the center and shake them as fast as you can, just for 10 seconds. 10, 9, 8, 7, 6, just 5 more seconds. 4, 3, 2, 1, and relax. Close your eyes, let the palms be resting on the knees or the thighs, open to the ceiling. Let the eyes be gently closed. Take a deep breath in and let go totally. One more breath in and exhale. Feel the sensations in the palms, feel the tingling sensations. That is the life force energy, the prana that you can feel in your hands, in your arms. Breathe in and breathe out. Just notice if your mind is with your body or if the mind is traveling far away. If it's thinking something else, just bring it back to the sound of your breath. Take a breath in and exhale. Become aware of your body. Your body is a beautiful gift given to you by the nature. And the female body has the potential to be a part of making creation happen. Just be grateful for having that opportunity. Take a breath in and breathe out. Relax the feet, relaxing the knees, thighs, hips. Become aware of your genitals. With a smile, take another deep breath in. And with a bigger smile, let go. Relaxing both the legs totally. Become aware of your abdomen. Your chest, back, right shoulder and arm, the left shoulder and arm, take another breath in and breathe out. Become aware of all the muscles in the neck, face. Relax your cheeks, chin, nose. Relaxing the eyes totally. Let the forehead completely relax. The top of the head, the back of the head, relaxing every muscle, every cell in the body. Take a breath in and exhale. Just notice if there's any tension, any stiffness anywhere in the body. Take your attention, sending some love there. Sending a deep breath in there. As you exhale, feel that tension move out of the body. Feel the body relaxing a little more with every exhalation. This body is like the wick of a candle, and the mind is like the glow that surrounds it. Feel as if your body is engulfed in the mind, just like a flame surrounds the wick of a candle. One more breath in and exhale. मनोबुद्ध्यहङ्कार चेतानि नाहम् न च श्रोत्रजीवे न च घ्राणनेत्रे न च व्योमभूमिर्न तेजो न वा चिदानन्दरूपः शिवोऽहं शिवोऽहम् चिदानन्दरूपः शिवोऽहं शिवोऽहम् चिदानन्दरूपः शिवोऽहं स्वरूपोऽहम् You are that consciousness. Just rest and repose within yourself. Feel the peace and bliss showering all over you. Take another deep breath in and exhale completely. Become aware of your body. Become aware of the surroundings. Let there be a big smile on the face. See if your lips can touch your ears. Slowly bring your palms in front of the heart in a namaste. Gently bowing down our head, just praying to whoever we believe in, for a healthy body, for a peaceful mind, and being grateful for all that we have got in our lives. Taking your own time whenever you feel complete, you may open your eyes. How is everybody feeling? How was your experience? You can show a thumbs up. Okay, not so good. Anything is fine. Okay, very nice. Little bit of meditation can set a lot of the things right. Especially for the female body, because females are very emotion driven, which is a strength. It is not a weakness, and that is the reason they are the center of the family as well. And that's why so much importance was given to the females in ancient India. If you see, in ancient India, women were exempt from doing all chores, all things during their menstrual cycle, and a lot of it has been, uh, as tradition goes down, things have changed, but people do not understand why that was there. Because menstruation is a time for us to go within ourselves. It is a time for us to be introspective. And that's why our ancient seers, they knew all this, and that's why they had given the females total freedom during those days. They are not supposed to do housework, they are not supposed to do anything during that time. Hmm? There was nothing to do with, okay, untouchability, or okay, you're impure. That was never the thing. So we should be proud of this thing that we can do as well, because this also gives us a chance to bring creation on this world. You use it or not, or whatever that is there, but the female has that ability. So yeah, we have questions, Urvija. There are quite a lot of questions.
Yes.
So we'll take up the questions. We have what to do for lower back and severe headache during the periods, Deepa is asking.
Yeah, I've mentioned that this while talking while the session, right? So when your vata, which is the nature of vata, is to move downwards during your menstrual cycle. That is how your blood is going to come out. But then your headache or your bloating or anything stagnating the amount of air in your body is going to start creating pain in those regions. So I suggest you take care of your good food, what you're eating, take care of that. And if it is not coming down, you'll need some medicines for that time. We'll just help you. I take even online consultations, so you can just give me a call or drop in a message about it, because I'll have to take a lot more history for this than just telling you in general. So headache, if it has reached your head, so that means that your vata is reaching till there, right? It is as simple as that, that the vata, instead of moving downwards, it is moving upward. So that is why it is all pain.
So one of the things I would also like to add is, like, especially when it comes to lower back pain, a little bit of yoga can also
Yeah.
help. So a lot of people, do not know what kind of a practice to do during periods. You should be doing very simple things, very easy things, but you can do a yoga practice during periods. You're not supposed to do anything intense, anything which aggravates your vata. Don't do anything like that. Don't do inversions, because I'll tell you a little bit, like in our body, apana prana is the one which is responsible for the menstruation. So the apana prana usually flows like from navel to the cervix. And during our periods, if we are going upside down, the prana is basically reversed. So rather than it going down, it goes in the opposite direction. And if you do very intense activities, it places a lot of like the pelvic region is already very, very, at that time in pain, and it's in a lot of like contracted, not feeling very good. But if you do something very hardcore, let's say running, or you go to the gym just to show how strong you are, or you just, because that's become a lot, I've seen it in a lot of people. They feel that, okay, even during in our periods we can do this. So that's not a very good idea, because it will, the area which is already inflamed, it will cause more tension to that, and in the longer run it's not really a good thing for anyone. For the lower back pain, simple things will help. We also made a special series, a 3-day series, which you can do in your periods. So the day one is just lying down. A lot of it is also focused on the back as well. So you can check out, it's there on Fit and Calm in the playlists, yoga during periods. So the day one is just lying down. You can do it for day two, day three also, if you're someone who has a lot of pain and you just want to do something lying down. So we've made one lying down practice. There's one practice which is sitting and very gentle, and there's another where you have like a little bit more movement into it. So you can check out, but these are things which you can practice, and easy, simple things during your periods to help with the pain. So Urvija, next we have, there's a lot of irritation days before the period starts, premenstrual syndrome basically, and just before the period starts there's lower back pain, there's stomach and legs pain. How do
Yeah.
avoid that?
A little bit of changes get show by the pain in your body. So if you can you can, if you can just take that pain, I mean, if it's not very aggravated, or then you do not have to take any medicine, because that is something which is normal. Your uterus has to make movements for your blood to come out. So those few movements are causing a little bit of pain, which is okay sometimes. But if you cannot take it, your day-to-day activity is being hampered, then you should take care of your all kinds of pain. Like I keep repeating that you should take care of what kind of food you're taking, what kind of activities you're doing. Because today, if you have taken something, the pain does not show just today. It is something that you have been taking since a long time, and you just cannot you should start right now about what you're supposed to do and what you're supposed to just avoid things. So to avoid all of these things, you can gently massage when you're not menstruating. First thing, you can use any kind of oil. You can use coconut oil, you can use sarso ka oil, that is we call masha taila in Sanskrit, where you can use tilla oil, sesame oil. So all of these things you can just use and warm the oil a little bit, and then do halka massage on your wherever it's paining, and then you can do the hot fermentation in that area. But do not massage when you are menstruating. Keep that in mind. You do not have to use oil on your body when you are menstruating. Other times, yes, you can do it. During your PMS, especially, you can do it. And also during your PMS, you just take care of your mental health, specially because the hypothalamus is the most active during that time. That is why you have all these menstrual disturbances also. Sorry, emotional disturbances also, right? So just take care of that, and understand that it is PMS that is causing this thing. So you'll start, you start becoming aware about it, and then it automatically gets into control that this is something that is happening in my body, which is natural. So it's okay. Okay. Yeah. And also, one more thing to the last question, I wanted to add what you were telling, Kushpindarji, that, yes, the activities that they show during sanitary pad ads, these are all so wrong. They show that if you use this particular pad, yes, you can go trekking, but this is not you're supposed to do. Like you said, in the olden days, they were given that time gap to relax, because your mind and body both need that mental peace, and that the halt that we say from the day to day routine. So yes, that is very, very important. But nowadays we just think that we just move faster, which is to be slowed down during these days. Yeah.
We have question on I get lower stomach cramps and feel stiffness in the center nerves as I feel downward movement. Is it normal?
Yeah, if you can hold, I mean, if you can take that pain, then it is normal. But if you cannot take that pain, if again, if it's hampering your activity, you're not able to attend to your job or your household work or anything that you do in a daily routine, then you need to take care about it. If not, then yes, it's good to go, but do not exaggerate much.
We have a few questions from Ankita Basu. What's the age group nowadays when perimenopause sets in? Dietary changes during perimenopause to go through it quickly. My menstruation stays for 2 days, stops on third day, and starts again on the fourth day. Why is this happening?
If it's been since you have been menstruating since the start, then it's okay. If you've got changes like recently in within 2 years, past 2 years, then it's probably because of your work pattern. Maybe you have changed your work pattern, or your day-to-day activity has changed, or it can either be, it can be as small as change shifting from one place to the other. Also, this also shows in your period that that particular area has an effect on you, that particular climate has an effect on you. So there are a lot of things that come in. So I cannot just generally tell you what is happening with your body. But then again, if you can take it, then okay. If you cannot, you need to take care of what is happening, what is wrong in your dietary, what is wrong in your activity. Okay.
We have a question from Kajal. I have a questions for mother and aunt. Why do women have to undergo uterus removal while menopause? Also, any suggestions for heavy bleeding?
Yeah, uterus removal is the last option because that is what makes you a woman, right? That is what is making you unique. So that is the last option, and that too happens because when your family is complete, when you do not need it anymore, is what we say that you can remove it because it's causing a problem. The bleeding cannot be controlled either by medicine or anything. Then that is when the doctor suggests you to take an hysterectomy. That is called hysterectomy. So, but for heavy menstrual bleeding, you need to understand what is happening first in your body. Is it hormonal, or is it because of the fibroid that is present, or there is any other thing, any other underlying cause that is present? If it is something like that, then that has to be treated first. Otherwise, if it's hormonal, again, we'll give you medicines for it. Not hormonal medicines. I do not give hormonal medicines. We give you Ayurvedic medicines to balance your hormones. And during these times, heavy menstrual bleeding is also because of stress. You need to take care of this, meditate daily, take care of your hypothalamus, basically. The cycle starts from there. It's like hypothalamus, pituitary glands, and then your ovaries. We call it HPO axis. So it is hypothalamus, pituitary, and the ovaries. If you take care of the head, the axis, then you'll take care of your complete body, right? So do that, and like I said, heavy menstrual bleeding can be combated by this. Don't worry.
No, I just want to add a little bit over here. So the Vedic knowledge is like so nice. Ayurveda and yoga has such nice wisdom. The pituitary gland, where it is located in the yogic language, we call it the Agnya Chakra. So the Agnya Chakra is what actually gives the orders to the entire body, to the rest of the body, where all the hormones, everything stays well. And when you meditate, when you do like pranayamas, breathing practices regularly, your entire body stays like that. So the hypothalamus, pituitary, that's what is impacted the most when you meditate, and then it gives agya to keep you healthy totally after that. So make sure you meditate
Yeah.
every day. I personally like practice Sudarshan Kriya and the Sahaj Samadhi meditation programs. I've done that. So I like meditate 2 times a day and practice the Sudarshan Kriya, and that's something that I feel has helped me a lot in like staying calm and maintaining that, because during our periods I feel we are a little bit more emotional than normal. Some days before, some days less. Some people are a little more and some people are a little less, so it differs also for everyone. But I would suggest, if you have not done, give it a go. We keep having these programs regularly. We are having one from 5th of November, so you can ping us either Insta here or on YouTube as well, if you want to undergo any of these programs as well. We have one more question, Urvija. If periods fall on our traveling days, is it advised to postpone the periods by taking medications?
You postpone your periods by medication is through hormones. The hormonal pills is what we give to postpone your periods. So it's something like you're hampering the natural thing that is happening, right? You're telling the clouds, do not rain today, please rain tomorrow, which is not very natural, right? So yeah, you can do it, but not very encouraging. I do not prescribe that because something which is naturally happening, you're just hampering in between, and you expect the next cycle to be normal is not very advisable, right? So it's just that it might happen or might not, but it is always a retrospective study that you might have taken, and that is why this is happening. So instead, just avoid things like this. Plan your travel dates according to your periods. Do not plan your periods according to your travel dates. Yeah.
Okay. So I'll just recap it a little bit. One of the things which we want to happen in our periods is not for our vata not to aggravate too much. So vata is what causes the movement, which causes the flow. So any kind of activity, any kind of food which increases the vata, we should make sure we have it a little less. And ideally, it's a good thing if we start doing this at least a few days before our periods, because then the periods can happen like smoothly without much pain. And again, the periods are not just those 5 days, so you have to take care of yourself even for the rest of the month as well. That means a lot of good food. And one more thing which I would like to add over here, apart from the things that Dr. Urvija mentioned, is also make sure that you have a lot of greens in your diet, because as women who are menstruating, it means that all that blood that is formed in your body goes out. So a lot of the women are anemic, and in India the number is quite a lot. So if you just make sure that you have some amount of greens in your diet every single day, that is taken care of. So don't do any intense activities. Let it be for the period product ads. So you chill, relax, do a little bit of yoga, simple yogic practices like some forward folds, with some pampering, with some pillows. You can check out our series for that. And do not eat vata aggravating foods, especially during your periods, which is foods like potatoes, brinjals, dals. One thing which you can have is good jaggery and soft rice, kind of like kheer, so that will help. And hot fermentation will help you. Hot drinks also will be very helpful for you. So you can just have some nice hot drinks which you can make, some tulsi you can add. You can just add these simple things which are available in your kitchen, and you can cook up something nice with that without going for something too fancy. Have simple meals, put ghee in your meals, and do not take a head bath during the periods. Do not have anything which is too sour, too spicy. An absolute no for junk food, fried food, any kind of processed food. Even if you like to eat, just make sure at least 5 days before your periods you start doing these things, because this will also help a lot. And apart from this, get plenty of rest as well, because this is the time to introspect. So rest also does not mean just like sleeping, lying down. It also means like mentally having that rest. So rest doesn't mean watching Netflix. That also does not give rest. So rest to the mind and the body. And another thing that we should not do is sleep during the daytime in our periods. I think this one, Dr. Urvija had told us last time. I remember it. So that also creates a lot of imbalance in the vata. So during your periods, you can lie down, but just make sure that you do not sleep during the during the daytime in your periods. And maintain a good regime normally. So if you do yoga for the rest of the month, it will also ensure that your body stays in good health, and during the periods also you do not have so much pain. So even if you are practicing for the rest of the month, just the practice will differ. During the periods, your practice will be a lot lighter, a lot it's going to be very restorative during the periods. But during the rest of the months, your yoga practice will really help you. And we also have a lot of yoga videos. We send out a monthly yoga calendar for everyone, so that you have a new practice to practice with you every single day. So you can check that. If you want that, you can just leave your email ID over here in the chat box as well. And I think we've covered everything. There's just one last question that came in the meantime. What is an alternative for ghee? Ghee smell irritates me a lot, and I tend to avoid it.
Yeah, there's, in Ayurveda, we have two main things, that is the ghee and the honey. So, ghee is something that nourishes you, and honey is something that helps you deplete some things in your body, like during your fat reduction. So, ghee, I do not suggest any alternative for the ghee. It is something very unique. Take ghee, the smell you can avoid by adding on to or adding into some food, or adding some aromatic things to it. Do not have the aromatic ghee as such, but then add it to your food, then it wouldn't irritate you much. Start taking bit by bit. Do not take do chammach ekdam se. Start taking a little bit, and then you'll have that thing in you that you can take it. Don't worry about it. This is a very small thing, but it is going to help you in the huge problems that are happening in your body. Yeah.
You can put a tiny bit, and also
Yeah.
see if you can get A2 ghee rather
Yeah.
than the ghee. It's much better to have the desi cow ghee. That's what Ayurveda recommends.
Yes.
So, was this session helpful for you all? Would you like to share any of your experiences? You can just raise your hand, or I'll unmute you. You can leave your in the chat box also. You can just leave your comments. Okay. Dr. Urvija, do you want to say something? It's I think either you are frozen or I am frozen. Am I audible? Okay, I think some issue on her end. So Madhuri is saying it was very helpful and very patiently you both have explained everything. Pragna is saying thank you so much, very informative and awesome. I'll start with a drop of ghee. So thank you all for joining. Hope you have happy periods, easy periods. And if you want to know, more, we keep doing a lot of things on periods and related to women health. You can follow us on Instagram as well and on YouTube if you are not following yet. So we are on Fit and Calm Yogic Living, and it was a pleasure to have you all over here. May you stay fit and calm. Thank you, Dr. Urvija.
It was really nice to be here and meet everyone. Thank you for having me.